Okay, I think you're good to go, Dan.
Brilliant. Well, yeah, thanks so much for having me. Can everyone see that, by the way? Um, Fabulous. And sorry if there's any noise in the background. Our bathroom is currently being broken apart, but hopefully that won't disturb us too much. I'm going to be presenting a bit of research that Sustrans, the Walking, Wheeling and Cycling charity, did last year. I confess this was not my research. I only joined Sustrans in October. The amazing Megan Streb, who now works at Centre for Cities, put this together. So hopefully I can do it justice. The research spoke through local authorities in England primarily, but I think there's a movement on this across the UK, and in particular Scotland are doing some really interesting work on this, and I think the recommendations are relevant. The research examined how local authorities consider walkable proximity within site allocation for development. So to start off, why should we care about walking and planning? I am preaching to the converted here a bit, I feel, but walking obviously matters to residents to start off with. Sustrans every 2 years run something called the Walking and Cycling Index, where we survey 23,000 people across 17 cities and towns in the UK. And our last one found that 4 in 5 people supported the creation of 20-minute neighbourhoods. And the way that we defined that was having various things locally to them, the things they need on an everyday basis. And just under half of people, so 45% of people, thought that they currently couldn't get to everyday destinations without driving. I think this is relevant because when Scottish residents in a separate study were asked about what matters if they moved houses, they said that being able to walk to local shops and walk to a regular bus service were far more important than a convenient drive to work or to the town centre. And actually, when you look at it kind of in distance, walkable distance does matter as well. So the National Travel Survey in England, ZFT conducts, and various other bits of research have found that half of walking trips are less than 800 metres. And in a survey in 2012, looking at suburbs and urban edge, almost 90% of trips under 400 metres were walked, you can see in that graph, but that drops really quickly to 48% of 800 to 1200 metre trips. And it also varies depending on what sort of destination it is. So that's what's called distance decay. Keep some of those distances in mind when I come back to what local authorities are currently doing, because I think that's quite interesting. And national guidance also is clear that walkability is important, that proximity is important. So in the English context, DFT and what was Public Health England and Sport England all agree that 800 metres is about right, as does the National Design Guidance, which says that well-designed places have walkable facilities at 800 metres. But when it gets to the kind of nitty-gritty, the planning policy guidance, although it mentions proximity, there's no standards or set methodology behind how you take that into account. And I think that's probably what we're going to come to a lot in our discussions today, that lack of consistency. So we know that people value living near services that they need, that if they are close enough, they will walk, and that government guidance tells us how far is walkable to a small extent. But how are new developments doing on this? Well, the picture isn't very good. The Place Alliance looked at 142 developments in 2020, and this quote on the screen is pretty damning, I think, that most developments are failing in this regard. That's been backed up by a lot of different research from RTPI, from Transport for New Homes. All sorts of different people have found that. And this is important because although you might come back with the argument that strategic sites will often have the promise of facilities to come as part of their contributions, the phasing of that's really important. If you're going to get your first primary school, let's say in the third phase of building, then new parents who've moved to the area will have had to buy a car by that point, so they're unlikely to then suddenly give it up just because the facilities have moved there. So the proximity is really important regardless of developer contributions. Let's get to the research itself then. So this looked at what local authorities are already doing. It looked at questions like, did the different local planning authorities have a consistent process, even though there aren't set standards in national policy? It looks at the difference between rural and more built up areas, and also how those distances were actually accounted for. It was a survey to local planning authorities across England, excluding London because it's quite a unique case. And we got responses from 100 LPAs, which is a really good rate. We also followed up with some interviews. And just to say that of those who responded, it was mostly rural and suburban authorities. But we were asking them all sorts of different questions around their current practices and also barriers to considering proximity. And I think that this discussion could be really interesting for getting past some of those barriers. So what do they say to us? Well, most authorities do already consider proximity. 90% consider at least one destination when they're thinking about site allocation. And over half of them, you can see on this graph, consider 5 to 7 destinations. There are various different destinations they'll include. But it's the methods that they take in measuring whether a site is close to these sorts of destinations that's particularly interesting because it varies quite a lot. First up, GIS capacity. So geographic data is really mixed in councils. And I think those of you who work in or with councils may have found this. So just over half of respondents did have resources within their team. But on the other end of the spectrum, around a quarter use Google Maps or something similar just to manually check distances. On the good side, a majority of rural and urban local planning authorities were using the road network to measure distance, so how far you actually have to walk rather than just as the crow flies. But interestingly, they didn't do that in urban and suburban local planning authorities too much. And the other difference that makes a lot of difference actually is around whether they use the edge of the plot or the centre. So if you've got a large new development, it will make quite a difference whether you're measuring from the centre of that so that everyone within that new housing development has access at that proximate range, or whether you're using the edge. So in suburban areas, they were more likely to use the centre. But interestingly, in rural areas, they were more likely to use the edge. And that really, those sorts of differences really affect this a lot. The other difference that's quite interesting is that some local planning authorities said if it's already within the existing settlement boundaries, then they won't bother measuring this, even though we know that there are lots of existing settlements that don't have the services that they might have. This graph has a lot of data, but there are 3 main points that I want to give to you from this. The first is that there's a really wide variation in the distances that are used for measuring proximity to services. So 800 meters is clearly the most common, but there really is no standard approach. If you think back to the work that I spoke about at the beginning from Barton and their colleagues, over half of these distances end up being beyond what most people would be willing to walk. The other thing that's interesting, so here we divide it down between those councils that use a cutoff, a clear threshold, and a range. So they allow anything between 600 and 1,000 meters, let's say. So when they use that clear threshold, it was not set above 800 meters. But in 71% of rural authorities, and actually 100% of suburban and urban authorities, if they were using a range instead, the maximum distance in that range was 800 metres or above. And then this is just a kind of slightly more simplified version of that last graph, but it more clearly shows just how many places are using distances over 800 metres. And the thing that it doesn't show quite as well, I think, though, is that there were 22 different lengths used in total out of 100 respondents. So there really is no standardisation across councils on how they're measuring proximity and walkability. But I guess, does it really matter whether it's 800 metres or 2 kilometres if they're actually using it to allocate sites when they're doing their site allocation? Well, let's have a look at this. So 16% of councils said that it had been a major reason for a site discounted. So it does happen. And 35% said that they'd rejected sites and proximity was one of the factors within that. At the other end, though, there are 20%, so 1/5 of respondents who are saying that they rarely reject sites that are deliverable or achievable because of proximity. So there clearly are barriers to people using this. And we asked them what those would be. You can see here that the main barrier that was identified was a lack of robust planning guidance or regulation. I think that is something that's changing, especially in the Scottish context. That has really started to change. The new national planning framework does give some clear mandate on that, but it's not quite the same level in any of the other UK countries. And in interviews, these sorts of findings were echoed. So we heard from one officer in a rural council who said that we really don't have much say in how much land or what our housing targets need to be for the next local plan. So we've just got to find the best fit for all these new houses. And then in a suburban council, it was slightly more damning, where someone said we were a bit careful not to just say, oh, it's not accessible to these 10 facilities, that's it, we're not going to allocate it in the plan, particularly because we were aware of the level of development pressure that we had. We felt like it wouldn't stand up too well in examination if that was the only reason for refusal. So it's clear that people at the moment within authorities don't feel that it is justified to use it to discount sites. And so that puts question on whether it actually is being used properly at all. So off the back of this research, we had a few recommendations, both for local government and UK government, which in this context would largely apply to England, but I think that, again, the recommendations should be relevant to people. So we've seen that distance is key and that it's not going properly. So the report tried to take good examples as well as bad, where councils are already working well on this. With the UK government recommendations, there's currently a refresh of the National Planning Policy Framework, which is where most planning policy is set out right now, although that might change in a bit. And we believe that part of that refresh should be a new policy that regards high quality walking environments, but that also includes within it proximity to local services and facilities. To aid the councils in delivering that, we think that there should be a digital tool created that supports councils to measure that proximity and to use it within their site allocation process. And then getting down to the local government level. So we've backed up a report from the Chartered Institute for Housing and Transport, which said that there should be a spatial vision which uses mapping within each authority to clearly show stakeholders the locations with best accessibility. We also said that they should develop supplementary planning documents that set out these accessibility standards, and that's worked really effectively in both urban and rural councils already. And and that would be based around 800 metres, but building on that. And then we said that there should be some background accessibility papers analysing the importance of walkable distances within their council. And then there are a couple of others that we suggested. So a clear change is that even within settlement boundaries, we believe that the council should be measuring proximity to those services. And we also identified that sustainability appraisals, which are within the strategic housing land availability assessment process, should be used and should include proximity, so that you could discount these unsuitable sites that are currently getting through. And I guess to help both national and local government, that's where it's really interesting for us to get together, because although we've set out those recommendations, actually there is some more work that needs to be done to put together best practice. And I think there are two main areas that I would want to highlight on that. The first is different needs in walkability, and the second's how you set out some clear standards. So on different needs, the first area is, I guess, working rather than working top down and saying this is what this area needs, and we're going to now start to deliver it in, I guess, the traditional 20-minute neighbourhood concepts. The Young Foundation have done some really interesting research recently on how you could work with communities to see what they value about their community at the moment, what they want to change about it, and to use it as a kind of leaping off point for a number of different conversations about the future of their area. I think another area of different needs that we need to think about is rural areas. I fundamentally disagree with people who think that proximity isn't something to think about in a rural context. I think that rural councils have been doing amazing work on mobile services, for example, on all sorts of different ways that you can think about proximity in a rural context. And the Scottish Government have just put out some interesting case studies on that. And the final area that I think is perhaps most interesting is looking at the needs of disabled people within proximity. This is something that Sustrans really wants to take forward. We're about to apply for some funding to do some work on this, but it would be interesting to hear from others who want to work on this area as well, because the needs of disabled people could be very different from non-disabled people in this area. From the accessibility of the services themselves and the amenities to the distances that people may be able to walk or wheel, to the accessibility of the pavements on the way there. There are so many different things that need to be considered if we're going to truly make it proximity that's relevant for everyone. And then the other side of that is clear standards, because we've seen that right now there aren't those, and we can tell national governments to come up with clear standards all we like, but if we're not clear on what exactly we need, then I think we're on to a losing battle. So I think that's building on 800 metres where there's a pretty clear evidence base, but as we've seen for different services there is a different need for how close it is, and I think that part of this conversation is around how we deal with that. So yeah, I'm really interested to chat to you all today. Feel free to read the report. I'm sure that I think the link's been sent around already, but if not, it's up here. And I'm very happy to take questions, but I'll preface it again with it was not my research, so sorry if I can't answer your questions. I hope that was helpful.
Brilliant. Thank you so much, Dan. Yeah, we'll have a couple of minutes for questions now, so you can get clear in your mind what's just been presented, and then we can kind of come back with reflections and discussion towards the end. That's all right. Any immediate questions from anybody? Put your hand up or put a kind of virtual hand up. Yeah, Eddie. Sorry, I think you're on mute. I put you on mute. Oh, it's not off mute.
Oh.
Hang on 1 second, you're on mute, Ellie. I don't know how to take her off mute. Can you take yourself off mute, Ellie?
I can. Yes, I've managed to do it. Thank you, Amy. Thank you, Dan, for that interesting presentation, and thank you for letting me ask you a question. So I live in Ceredigion, which is a very rural county, and on top of that, I live in quite a rural area of that county. And my question is, the 800 meters seems to be quite a sensible distance, but you didn't mention anything about safety. So I'll give you an example that here in Ceredigion, we've had lots of small schools closed down, which leaves parents of primary school children who are still within the guidelines of what is supposed to be a walkable distance to get to school. Therefore, they don't get any subsidy to actually get to a school. So no, they're not allowed to get on the bus, or unless they pay for it, but the roads that I have to travel on are lethal. So even if you're only within 800 meters, if there isn't a pavement along an A road, or and you don't seem to say anything about that, and I just wonder what you made of safety concerns. Thank you.
Yeah, that's a really good point. And I think safety and accessibility go hand in hand there as well, because even if you are using the road network to measure distance rather than as the crow flies, whether that's the fact that you're going to have to be sharing the main highway with vehicles, or the fact that there aren't drop curbs for people, or that the pavements aren't wide enough, even if there are, those things really do tie together. And I think that part of coming up with some set standards around this would be saying that actually it's not just about measuring road distance. If you're using these interesting geographical tools already that do have the ability to map whether there's a pavement on that road, whether that pavement is 1.5 meters wide or not, then those sorts of things need to be considered in that. And I think you're completely right, they should be. I'm not sure if we spoke about it much in the report, but especially on single carriageway roads, bus transit working more and more to talk about speed reduction, and saying actually they're some of our most unsafe roads already, even though there may be fewer people walking down them. The KSI stats can be really damning. So yeah, it's definitely something you speak about.
Thank you.
Thanks, Han. Anyone else? Gonna go with no. Okay, well, we can come back to this in discussion. Should I hand over to you, Demetrius? Thanks, Dan.
Sure. You. Okay. Can you see my screen? Yep.
Yeah, we can see it.
Yeah.
Not as a full presentation though, but that's up.
Is that okay? Yeah. Should be fine. Right. Good afternoon. Thank you, Amy, for the invitation. Just to give you a little bit of background, my name is Dimitri Potoglou. I'm a reader in the School of Geography and Planning and course director for the Masters in Transport and Planning. The work I'm presenting today is done in collaboration with my PhD student, Fahad Al-Bakhlal. And it's about identifying priorities for walking and cycling investment. And here we take what I call a citizen-oriented approach. So, as in other areas in the public domain, local authorities operate in an unlimited budget. So it's quite crucial to balance this need or obligation to meet the requirements for walking and cycling, but also allocate resources in a kind of fair manner in a way. And of course, this is quite relevant for Wales as well, because it's the first legislation which encourages local authorities and decision makers to develop infrastructure, to improve infrastructure for walking and cycling. So that's our motivation then, was how can we devise an instrument, a survey-based instrument, to be able to capture these aspects or domains of walking and cycling infrastructure that should be priority compared to others, and collect these views or priorities from a citizen's perspective. So what we've done with Fahad was to look at the different audit tools. So basically, these are tools that are being used to evaluate the infrastructure. So experts would visit, let's say, an area around the station, and then they will mark in a kind of a green light system from red to green, whether the infrastructure is of appropriate standard. So we converted those factors, those aspects, into a survey-based questionnaire. We've looked at several audit tools, including the ones in Wales, but also in Hong Kong and in the US and other countries. So we made a selection of the most frequently found factors. And we ended up with a list of 21 factors. Now, if we tried to put this forward to a respondent, to a citizen, and ask them to rank those factors, obviously this is quite cognitive heavy for a respondent to provide an answer to. In some cases, other studies have used rating scales. So you can imagine that each a factor will effectively generate 21 questions asking people to rate how important each of those factors is. And obviously, you start getting quite a lot of overlap because some of those factors might not be important at all, and people would say so. And also, they might say very important. So it's quite difficult to distinguish in terms of priorities. So an alternative way to do that is to use a method which is called best worst scaling. Apologies. So I'm just trying to. So best worst scaling, the key drive of implementing this method is obviously reduce cognitive burden, but also it presents a set of nice priorities because it emphasizes only the extreme aspects of a range of factors. So firstly, it allows us to, in a way, present partial sets. So instead of 21 factors, have, for example, in this case, 5. So the cognitive burden is reduced, but also emphasizes on the endpoint scale, which is, again, easier for a respondent to select what is the highest priority and what is the lowest priority. So in this hypothetical scenario, we ask people, if your local council were to spend money, what should be the priority in order to encourage you to walk? What should be the highest priority, and what would be the lowest priority? And of course, this is a kind of an abstract form. You see, this is underlined here. So we were able to implement some explanatory text as well to explain to respondents what we meant. So this is an example about walking, and we applied the same for cycling. Again, we looked at a number of audit tools related to cycling. So you can see here things ranging from surface material, quality, gradient, safety related issues, traffic volumes, lighting, different delays, route provision for cyclists, and so on. So again, in the same idea, another important thing to emphasize here is that we can obviously repeat the questions many times, because each time we would select in a kind of a strategic way or statistical way the subset we want to present, and then elicit people's preferences for that subset. Now, the analysis is quite informative in the sense that we can derive a complete ranking of the different factors. So those that are positive, for example, the footpath provision and the footpath condition, these are top priorities. And by the way, this is a nationally representative sample across the UK. And gaps in traffic and traffic noise are the sort of least priorities. And this is sort of a standardized scale. So there is absolute comparison between the footpath provision and the gaps in traffic. We can say how many times more important is footpath provision compared, for example, with traffic speed. And the same again for cycling. This is the complete ranking across respondents. So these are the sort of average individual scores, with top priority being, for example, dedicated pathways and pathway width, avoiding conflicts with high heavy duty goods vehicles, conflicted junctions, surface quality, and so on, and then noise and delay in junctions being the sort of least priority. This is a little bit more just a background in the sense of the analysis can be very complex, but also can be quite descriptive and still get meaningful and informative results. So, for example, in this case, we will count how many times these factors were chosen as high priority. That's the column here, the H column, and then how many times each one of those factors was selected as the least priority. And then taking the difference and the square root of them, then we can derive a ranking score, which is on a common scale. So the scores are comparable with each other. And the same again for the priorities for cycling. Another interesting aspect here is that we don't only look into factors, so for example, field of safety, lighting, but we can have different levels within those factors. So remember, I mentioned that earlier at the beginning of my presentation that people who use audit tools, they rate the different aspects of infrastructure into a green light system from green, amber, red. But using a method such as best way scaling, it is possible to obtain a ranking across all those levels, independent of where they sit. So, for example, number one priority might be to feel safe, and number two might be visibility, and number three being traffic noise, and following that might be the visibility to be somewhat improved compared to all other factors that you see across those three columns. So very quickly, what I'm offering here is another approach which has also been implemented in other areas. So it's fairly new in the transport and mobility field of study. But for example, I was involved many years ago, I was involved in a social care piece of work where there the idea was again to elicit what were the priorities and investment priorities to quality of life, service-based quality of life for social care. So, for example, it could be dignity and clothing and quality of the food, both from the user's perspective, but also from the general public. So that's an instrument that allows local councils to prioritize in terms of funding allocation. So compared to rating on ranking tasks, this is a sort of an unbiased way of eliciting preferences. So people concentrate on the most important and least important factors. And an important aspect here is that this method allows cross-cultural comparison, which means that if we run the same instrument between two countries, we are absolutely certain that we can compare the results. If we have a rating scale, what now 3, for example, neutral might be for a Dutch person, might be 4 or 5 very important or important for British citizens. So we avoid this kind of bias in scale because we have absolute scores in a way. And of course, another important aspect we discussed with Amy yesterday, that this is also an opportunity for co-creation opportunities. So we can work with local councils or decision makers more generally, as to what would be the factors they're interested in. Because as I mentioned earlier, we derived a number of factors related to audit tools. But maybe a council has a specific set of priorities, 10 or 15 priorities, and would like to know what would be the priority from the citizens' perspective, and where money should be allocated to improve quality of life, improve cycling and walking within a city. So there are these kind of opportunities, but also this is interesting from an academic perspective in the sense of trying to identify differences between different group of people living, for example, in urban, suburban, rural areas, or different countries, and as I mentioned earlier. So yeah, with that, I would like to close my discussion, my presentation. Thank you very much for your attention, and obviously happy to discuss.
Thank you so much. Tamara, I think you were the first with your hand up. Go for it.
Oh, thank you. Thank you for this presentation. So I really like the focus on people's experiences and on the prioritization of investment. And I'm a bit biased because that was really the topic of my PhD. My question is, our understanding of how objective features translate into experiences for different people is insufficient. And I found audit tools to be often problematic because sometimes they miss altogether factors that are important to people. Sometimes they talk about them in vague terms, for instance, traffic. So how much traffic is too much traffic? Sometimes they mix objective and perceived. So for instance, in your list, you had feeling of safety and then you had time available to cross. And those perceptions can be auditors' perception, not even people's perceptions. So my question is, how do you get around that? So I understand that you work with the audits, but how do you get around and the fact that these tools that you are and indicators you're working with can have problems in them?
Thank you. Yeah, all fair questions, and I'll try to offer as fair solutions and ways forward as possible. I should have said that taking the audit tools we took audit tools as a starting point, and then we went away and tested the instrument with people. So in some of these aspects, maybe I'm using an older version, but some of these aspects changed to align with people's understanding. So I agree, some of them are vague, or not entirely clear. We'll come into the different levels of traffic, for example, but there is opportunity, as I mentioned at the end of my presentation as well, to refine the instrument. So you can use audits as a starting point, then you can do focus groups, you can do interviews to refine and make sure that what we have in mind also aligns with people's views. You mentioned also this discrepancy of, how people perceive things and how things are in reality. There is a way, of course, there to kind of control for that by asking background questions. So capture people's perceptions and then try to compare how perceptions align, or different groupings of people align with the priorities they derive. The other point that you mentioned about not being very specific, and I take this point. So this is one method where it allows you to set priorities across factors. But later on in my presentation, I spoke about and I'll quickly share my screen. I spoke about this, which basically allows you to introduce levels. So here, for example, when we talk about traffic volumes, you could have, for example, 100 vehicles per hour, 200 vehicles per hour, 300 vehicles per hour. And then you can show this as part of a card where Now, this element here, the low traffic won't actually be an abstract term, but it would be 100 vehicles per hour. And then you can have another card that shows 200 vehicles per hour. And then people will, again, trade off between that aspect compared to the others to choose the highest and lowest priority.
Did you want to come back on that, Tamara?
Yeah, well, no, it's good, and I think it's good to get into the more specifics. I find it well, I think it's an important but also really difficult topic because for several reasons. First, you have different people. So you talked about people of different countries, but for instance, in my PhD, I worked with disabled and non-disabled people, and so what a disabled person, and I loosely put disabled people is a group. They are absolutely not a homogeneous group. Even between blind people, a blind person using a guide dog or a blind person using a long cane will have very different thresholds or experienced barriers. So that's a difficulty of individual characteristics. There is a difficulty of tree purpose. What are you going to accept and what are you going to just pass over, or what is going to be a no-go? And the last thing is the synergy, the environments. And you said, well, on your card you can say 100 vehicles or 200 vehicles, but I would say it depends. Is it 100 vehicles driving 10 per hour, or is it 100 vehicles on a wide infrastructure and with high speed? What are the conditions for crossing? So I think the risk is really simplifying it to a point where it's really hard to make conclusions. So for instance, I looked at what is difficult to cross, and there are 3 factors that could explain by participants what it is difficult to cross, and the 3 were measured, but it's really not. Yeah, it's a tricky topic. I think it's good that you're examining it, but I think the real risk is oversimplifying it.
Bear in mind, and yeah, sorry, I'm conscious of time, but bear in mind that we look at this from an investment perspective rather than trying to correct specific traffic situations or, a specific junction, let's say. But it's rather taking a step back and say, well, if we have a limited pot of money to allocate, what would we do? Yeah.
Okay. Thanks, guys. Lucy.
Yeah, I completely agree with Tamara's points, and my kind of questions or reflections were kind of a similar note. I think, perhaps the question for you is how useful is it for when we're deciding what to do with pots of money to aim pots of money at the general person? It's like we haven't got a breakdown of gender there, and we know there's gendered kind of perceptions around safety. There's differences there in the cycling model and the pedestrian model in terms of fear of crime, but that wasn't on the pedestrian one. And we know in kind of marginalized groups, if you take transgender people's perspectives, their visibility makes them more vulnerable, and then they have a different perception of safety. So I just wanted to kind of know your reflections on how do you imagine this being used in terms of investment planning? We know with investments now as well, but I think local authorities have to kind of consider gender even as a factor in their decision for where they're spending money.
I should have explained maybe a little bit better that what I presented is an overall average across the sample, but you can break down your sample into different segments. So for example, if you're interested into general population disabled people, yes, you can have two different samples to compare what priorities are. I mentioned the idea of social care earlier, where there we had, when we analyzed this some 10 years ago, we looked at service users and general public. So you can run comparisons then to see how those 2 groups are prioritizing things.
Yeah, it's also
I mean, in the research, is there, the difference between stated preference and like, okay, when you put a footpath there and actually it's by a busy road and there's a lot of noise and there's a lot of pollution, to then people actually go and use that footpath, or potentially if there's a lot of people that need to use a footpath, there was not one previously, that they use it because it's all that is there. Is there anything that's looking at, the gap between your stated preference and the reality of when that infrastructure is implemented? Does it work or not?
Well, it's just two different scales, because the one you are talking about is a very localized one. Yeah, so you're talking a specific path and with specific levels of noise, traffic, and so on. But this is a little bit more on a kind of the average picture and what you would like to see improved. I'm not sure. Yeah, I would say that it's just a different type of scale and of analysis rather than, yeah. I'm not sure if there is a way. It very much depends on how you set the context and what the choice context is. You may want to localize it and see, well, this is a busy road, this is the volume of traffic. What would you like to see improve in that particular road? But the way we approached it and the type of sample we attracted was, obviously we had to generalize more to be able to capture a wider sort of geographical scale, so to speak. It might be a Cardiff specific study where you say, well, this is North Road, this is the sort of traffic you experience, this is the noise. What would you like to be improved in that specific area?
Does anyone else want to build on that, or any other researchers do you want to chip in with these points? Graham?
Yeah, hi, thanks. Yeah, I was going to mention, I think it maybe builds upon the previous discussion a bit more, but it relates to this. Is some of the research we've been doing at the moment in Greater Manchester is really hammering home how seasonal some of these things are. And we've been looking in, I don't know if people know the area, but Lee in Wigan, and there's a very big kind of intersection that's sort of crossable by pedestrians like most of the year, or some of the year. By October, it's sort of likely to be flooded, so it's not really accessible. And by November, it's pitch black at 5. So, no one's using it. And it really hammered home that that's a completely different experience in October, November, December, as it is in, I don't know, April to August, something, or September. And yeah, that's something I guess I was aware of, but that this research has really emphasised that for me.
Yeah, really interesting point about weather. Madeline.
Hi. Sorry, I just want to say I'll put the Ros Atkins City of London street accessibility tool in the chat, only because when I saw him present it at the London Walking and Cycling Conference, he was talking about how like you mentioned, Tamara, I think there can be sort of conflicting priorities. Different groups have different needs, and he was talking about how this tool can kind of at least allow people to agree on what is the most accessible version of whatever it is. And I just also wanted to say that there was two studies I came across today, and I can't find them, but about how induced demand on roads works, induced demand on cycle paths now seems to work as well. And it's not, I work in a local authority, and we are kind of fiddling around the edges of trying to get things walkable and cyclable. And actually there are the guidelines out there to make highways for cycling and perfect bits of walking infrastructure, but they're not being done. It's not because we don't know what the scale of walkability, the quality scale is. It's because it's not there yet.
Mara?
Yeah, I'm sorry. I really don't want to hog on to the discussion. I just want to add that what I said was not necessarily conflicting priorities. Actually, I looked at what people perceive as barriers to walking, and I try to generalize it out of specific examples to generalize it. And what was interesting is that disabled and non-disabled people talk about very similar things. The difference is that for a disabled person, it might be, I just can't do that. And for a non-disabled person, it can be, oh, well, I prefer not to be here. And non-disabled people tend also to talk about aspects related to the beauty of the environment, whereas disabled people focus on really what is feasible and what is accessible. Reason why I think just reinforces the idea that we really need to focus on the needs of those who have who experience the highest barriers, and it will benefit everyone.
Yeah, exactly. That's probably a good note to end that bit of discussion on. Unless anyone else got a completely burning question, otherwise I'll sort of explain how we're going to go forward with this. So just for context, this is the first time that THINK, as the Transport and Health Integrated Research Network, has had this kind of meeting, which I've called Convening the THINK membership, which essentially one person has got a report, something that they want to make sure that other THINK members know about, i.e. Dan from Sustrans, and then we as a membership think about how we can build on that, how other people's research can complement it. If there are gaps, can we fill it? So now we've got to think about the tricky bit, which is next steps. So the good news is my colleague Charles here, the co-director of THINK, he's applying for some impact funding from the university to look at the impact of walking. He's also trying to start a new centre, which would include mobility and walking within that. Obviously, both of those things depend on him winning the funding, but there are avenues under which we can continue this discussion, you know, in a formal way that's got some structure around it. So just as a quick hands up, virtually or literally, if you've got your camera on, who would like to be involved with a secondary meeting, kind of trying to hone this into something where we can come up with some action points? Hands up. Yeah, I think we've got enough people to move that forward. Great. So that'll be what we do then. So if this has obviously been quite useful, I found it a really interesting discussion. So I can convene another meeting where we take what, basically, we all go away and let this kind of filter through our brains and think about what connections we've seen there and come up with something a bit more solid, as in, I can contribute this, you can contribute that. Maybe it means that we put together a joint bid for something to a funder and just say, we've got all this different expertise in different areas, and we've seen from what Dan has presented, what Dimitri's presented, the discussion points, that actually there's still quite a bit of muddle in understanding of some of these things. Extra research is needed on those potential distances around 800 meters for different user groups, for example. So yeah, and it's just with some of those legislation changes that Dan was mentioning in the first presentation, frameworks and guidelines and things, I'm wondering, I don't know if you might not be able to answer off the top of your head, Dan, but it might also be worth us thinking, is there a deadline to work to? Is there a sort of consultation going through or something where we can sort of, not exactly lobby, but influence and just say, actually, we've now done some research that shows you should be thinking about this when you're updating this policy? What do you think, Dan?
Yeah, there's a second review of the National Planning Policy Framework, the second in a year, that's happening towards the end of this year, is planned. So that's quite an interesting timeline to begin with. But I think there are also long-term possibilities going forward. For example, Labour are really interested in planning reform more generally, which will allow more examples feeding in if they do end up in government. So I think this isn't going to go away, but there are also short-term deadlines, which is quite a nice mix. Okay, great. So for the next meeting, or maybe if anybody can email me, I think you forgot my email, or at least the think@ABBA email, any ideas you've got on deadlines we can try and meet? Because that helps, doesn't it, when you've got something. Any ideas of funding opportunities you come across? If anybody, I'll send around an email to remind you, but I'll send an email saying, are you happy to share emails with each other?
If anybody doesn't want to, then that's absolutely fine, but that can sometimes help move things along. If just a couple of you want to have a bilateral sort of chat to move things forward before another group chat, then that can be really productive. So we can, you know, agree to share emails in that way. That can be useful as well. I've just read something from Rianne. There's a message from Rianne as well. Thanks, Rianne. So yeah, how does all that sound as a way forward? Thumbs up, virtually or literally. Great. We are bang on 4 o'clock. This is fantastic. Don't want to keep you waiting too long. Yeah, so thank you so much. Ellie, if you need to dash, that's fine. I think Rianne's gone. Yeah, so look out for emails from me, just making sure you're all happy to share emails. I'll give you maybe a couple of weeks and I'll send you a reminder before the end of that time if you've got any ideas around funding or whatever. I might also say to you, would you like to start a kind of sharing group? I know there's some issues around different organizations using Teams or what have you, or SharePoint, but we might be able to have somewhere where we can kind of have all these materials. Like if anyone's got any other resources you want to share, like Dan's report we could put somewhere, but other people maybe have reports, and Dimitri, your research and such. So yeah, all these things I can put together in an email so you don't have to remember them now. I'll kind of remind you all about it. Yeah, but it's been a really inspiring meeting, I thought, and when we've circulated this recording around to the 3 or 4 people who wanted to take part but couldn't be here, they very well may have some input as well. So 1 minute past, sorry. Okay, thank you so much for your time, and hopefully we'll see you again soon. Take care. Bye.
Thank
Bye-bye.
Thank you, Amy.